We're entering an era where we're focusing on treatment as prevention. So if someone has HIV and they're on effective therapy, this will result in a significant reduction in their viral load. And if that can be maintained at undetectable or zero, then this will be a lot safer for their sexual partners, particularly when they also use condoms. It's not always possible to identify women who have been exposed to HIV just by taking a risk history. I think medical practitioners should take opportunities to consider HIV in a number of situations. So to take an opportunity to offer or to perform a HIV test, for example, if a woman is having a pap smear and the practitioner identifies they've got a new sexual partner, then it would be opportune to perform a HIV test at that time. With casual partners, insisting on using condoms if you are able to negotiate to do that.
If a person does use recreational drugs, it's really important to not share equipment and always use sterile injecting equipment. If a woman engages in sex work, it's making sure they use condoms with all their clients. It's also important for people to know about the availability of PEP, which is post-exposure prophylaxis. It's one of the strategies we can use to prevent HIV transmission when people can access the drugs that we use to treat HIV within 72 hours after exposure to the virus. So if a person thinks that they have been exposed to HIV, it's important to access this treatment as soon as possible after being exposed. The medications can be obtained from any emergency department. We also now have the availability of PrEP, which is pre-exposure prophylaxis. So there are preventative strategies now that women can access, but often they may not know about these strategies.